Um, Anything else or any other tips you can give the viewers of other things they can do position-wise or breathing-wise or anything else just in your experience that helps kind of protect their perineum?
Yeah, so a couple of things during pregnancy. I strongly recommend, pelvic floor physical therapy, of course,
Mhm.
especially for anybody who has a history of pelvic floor dysfunction or who is an athlete,
Yeah.
right? So,
And
oftentimes,
explain that a little bit because it's
yeah,
really common and I like people to hear this because they don't understand. They think it's
yeah.
opposite.
So, as athletes, we get really good at contracting our pelvic floor. We
Yeah.
are not good at relaxing our pelvic floor. And
Right.
so, in some cases, that doesn't matter, right? Like you get to birth and you can relax just fine. But if you can get to the point where you are just as good at relaxing that pelvic floor, that is paramount to pushing. And it can actually help with baby's position. It can help with pain and discomfort during your pregnancy, and then also minimize damage to the pelvic floor after, like during and after labor and birth. So that's, I wish everybody would see pelvic floor physical therapy during and after their pregnancy. Um, and then the other thing is pelvic floor and perineal massage is
Mhm.
really helpful for those people as well because it can help to strengthen to soften and lengthen those muscles so that you do have a better time relaxing, and it increases blood flow and reduces the risk of tearing. And then, if you are able to, practicing being in a deep squat. So,
Yes.
again, just lengthening those pelvic floor muscles and practicing being in that deep squat with your heels down, even if you need the support of like the back, your back on the wall or something, just getting into that flexible position is great. And then during labor and birth, warm compresses, laboring in the tub, pushing in the tub, and that's going to be a little bit different for everybody's situation. A
Right.
lot of hospitals will allow laboring in the tub, but they won't allow delivery in the tub. Um, we're one of the few places in my city where where somebody can have a baby in the water. So, and that does help, just that warm water with blood flow and softening that perineum to help with stretching.
Yeah.
Um, and then flexibility. So really, again, a lot of people come into birth with ideas of how they want it to be, and we want to support that to the extent that we can. But if there is, um, if if it's not working for you, then we want to change it and we want to do what's going to be best for you and for your baby. And sometimes baby needs to be in a different position as well. So that can affect, fetal heart rate and that sort of thing. So sometimes we need to move and be in a different position than what you might imagine.
And a lot of what we talk about in the course too is having a good communication session or sessions with the
Mhm.
healthcare team. And I think one of the things that I think is difficult for people is it can be awkward. You might not have a lot of time in your sessions when you're going to
Mhm.
see your midwife or
Right.
your physician. Do you have any tips of how to have good, fruitful conversation in a simple way that's maybe not too intimidating for the mom?
Yeah. Um, it is challenging because appointment times as a rule are incredibly short.
Right.
Um, and I'm going to put a little plug in, midwives as a rule have longer appointment times and are going to be more receptive to a lot of those conversations just because it's something that we're familiar with, right?
Right.
So, if you have the opportunity, get a certified nurse midwife. But if you can't, then a doula, which is a professional birthing assistant, they're a non medical birthing assistant that is really, employed by and works for you as your advocate during that process, can be incredibly beneficial as well because they're going to kind of be that liaison. When you're in the midst of labor and you're in labor land, you're not going to be having those conversations, right?
Right.
Much
Right.
more challenging. And your partner probably isn't going to be in a frame of mind to have those conversations either. So having that advocacy is great. The other thing would be to have those conversations with your nurse because they are also your advocate.
Good.
So in most cases, physicians come in right at the time baby is going to be born, right? So they're not there through the majority of the labor and pushing process in most cases. There's some exceptions out there, but to have that conversation early on with your labor nurse is going to be incredibly beneficial as well.
Is there value to having those conversations maybe with the physician and or the midwife, of course, at earlier visits, like before
Yes,
you're actually in
definitely.
labor?
And depending on their reaction, you're going to get a feel for just how receptive they may be.
Right,
Um, I do think it's getting better, but there are, this is not me dogging on physicians by any stretch, but their training is just different.
right.
And so I think that having the opportunity to have that conversation and knowing and really asking the question instead of saying, I want to do this, say, what positions do women usually birth in with you? What
Nice
positions do they
question.
typically labor in? And that's going to be, more telling than describing what you want, because most of them are going to say, oh, yeah, sure, whatever. Right.
Right, right. That's a really good tip. That's a really good tip.
Yeah, but if you let them tell you, kind of how labors and births usually go with them, do they use stirrups? Are they familiar with, keeping the bed, in one piece for deliveries, or do they always break down the bed and remove the end of the bed? Because those are, and there are lots of videos to explain a little bit more about that, but that would take, yeah. But so there's a lot of different ways that you can kind of address that question and get a feel for how comfortable your physician is with birthing in different positions.
And about what you just said about breaking the bed down, if they've broken the bed down at the end, is that meaning that you're in like kind of a lithotomy position and you're down towards, okay,
It
it's not
does,
that they've
yeah. So
broken it
that
down so you
pretty
can
much
get creative in a better position.
correct. That pretty much
Okay,
necessitates the need for stirrups.
okay, okay.
Yeah.
Yeah.